Healthy Living is brought to you by the Rutland Regional Medical Center. The Rutland Regional Medical Center is using new technology to help doctors diagnose issues in the lungs. Since Dr. Mark Jacob joined the hospital from North Carolina in November, the hospital has started using what Dr. Jacob calls GPS for the lungs. Today, he's joining us to talk about the procedure and about the experiences in the Green Mountain State. Born and raised in Michigan, Dr. Jacob is used to the cold weather. Most recently, Dr. Jacob was living in Greenville, North Carolina, so this Vermont snowfall and cold snap is a throwback to days living in Michigan. Dr. Jacob is the new pulmonologist at Rutland Regional, specializing in issues with lung disease, asthma, COPD, and obstructive lung disease. Dr. Jacob brought new technology with him to the hospital that's helping more than just the pulmonology department.
We also, because we're lung specialists, we help other doctors who need information from the lungs. So if your cancer doc says there's something growing in your lung, then we're able to go in and get tissue samples, so that helps the cancer doc make a diagnosis. This
is video of the procedure Dr. Jacob calls GPS for the lungs.
We started doing this in November. It's a procedure that's been out probably for about 10 years. Part of the reason I came up here was to kind of spearhead it and help the hospital start doing the procedure. It is basically GPS for the lungs. There's actually is a purple line that tells you where to go, and the only thing that's not there is the voice that says turn left, turn right, and it doesn't recalculate if you go down the wrong air pipe or tube, the bronchus.
The system works thanks to maps created of the lungs from the radiology department.
This CAT scan images, so the radiology department gives us a CD, and we use that as a map, just like sometimes you had to update your GPS maps when the roads change. And so once we get the map loaded in the computer, we have a visual. We can see out the windshield and look at the roads and see what condition they're in. But then we also have our GPS or computer telling us if we're on the right road or not.
It enables the hospital in one procedure to get a diagnosis and also helps leave markers around the area so radiation doctors can better focus their equipment on the correct area of interest. Dr. Jacob says a main reason he chose RRMC is because of its dedication to the Rutland region.
It's a good hospital. It's focused on taking care of the community. That was one of the big emphases when I was being hired, is like, we want to provide good care to the community. And so taking care of the Rutland area patients in the community is the goal, and we're continually looking and evaluating procedures and the docs that we need to be able to do that.
A few of Dr. Jacob's pastimes include hunting for the perfect cup of coffee. So far, his favorite is at the Speakeasy Cafe. He and his wife are also pilots and avid flyers. They plan to spend much of their free time at the airport once the weather warms up. He also notes the area has been very welcoming.
I've enjoyed it. Everybody's been friendly. Everybody down south thinks that they're friendly, but everybody up here is just as they are down south.
To schedule an appointment with Dr. Jacob, call 775-2036.